Thank you to everybody who's joined. Apologies for the technical difficulties that we encountered with Zoom. My name is Sarah Hess and I work for the WHO Information Network for Epidemics here at headquarters in Geneva. I'd really like to welcome you to this webinar. From the end of June until today, WHO has convened and been hosting virtually the first ever infodemiology conference. And this conference has been organized by a large team of over 40 people in different roles from all three levels of WHO, country offices, regional offices, and headquarters, as well as from a large number of external partners and colleagues at the US Centers for Disease Control and Prevention. On this webinar, we are going to hear about the experiences and the outcomes of this conference. And so without any further ado, I would like to hand over to Tina. We are going to start with a short video where a participant is going to be sharing some reflections on the conference. Tina, over to you.
Great, here we go.
And it has been great a great opportunity for me to be able to share thoughts, ideas, and collaborate with peers from different academic disciplines or fields, and also with practitioners on how to better understand the current information environment, the flows of misinformation and disinformation, how to better prevent and respond to infodemics, and how to measure the effects of the exposure of misinformation and disinformation by individuals.
There are similarities and dissimilarities between the spreading of a disease and the spreading of information. The most relevant one being that information travels much faster than a biological virus.
One of the most interesting things I heard about was the use of personas in the development of targeted communication materials. This really gets to the critical role of identity in this issue. I enjoy participating in the sprints and learning about how others from so many different fields have approached infodemic problems.
So we've been working on NLP and machine learning for understanding social issues, but being able to learn about the need and social value of this for misinformation in the area of health has been eye-opening for me.
Think about not only what information is communicated to different audiences, but how it is translated and then received, and the real importance of understanding different communities' perceptions of what is valuable.
It was in topic 2 when Anis Aslan and Masato Kajimoto provided their lessons on information environments. We have used this interactive online mind mapping tool to together create a visual graphic of how misinformation can be addressed, where misinformation originates, how can we deal with it, how can we police it, how it can be corrected, and also what role social media plays.
It's clear that some practices and methodologies are transferable. It's clear that we can share these methodologies, but it's also clear that we are moving towards looking at ways that we can intervene to protect global populations.
So I'm happy to make connections with people from many disciplines, and I think solving a complex problem like misinformation would require a global effort, a coordinated effort, and I think this first World Health Organization was a very good step towards this goal.
I think that it's extremely important, especially for these new challenging visions, to have a test like this, because what happens today is that despite of all the resources that we have, there is not enough diversity in our discussions, and that was absolutely a crucial step forward.
Turns out I'm not just meeting with people who are smart and intelligent. They also have big hearts, and I think that is the most important thing. When we discuss each other, compliment each other, embracing each other, I became realize that working in this field, we need diverse perspective, and also we need collaboration more and more.
We need a coordinated response to fight misinformation and establish a community of practice which facilitates sharing of best practices and also coordinate our response.
Thank you very much, Tina, for sharing that video. I think we can see from the very global range of participants who took part in the conference that the concept and the problem of infodemics is truly a global problem. I'd now like to hand over to Margot Mattis, who is a technical officer here in WHO HQ in the Department of Global Infectious Hazards Preparedness. Margot was a part of the conference organizing team and supported the topic facilitators. Margot's going to talk a little bit about the structure of the conference, how it worked, and how people participated. Margot, over to you.
Thank you very much, Sarah. Hello, everyone. So yes, my name is Margot Mattis, and I'm part of the co-organizing team of this event. And in this closing day of the first Global Infodemiology Conference, I would like to give some reflection about the organization of the conference and what we collectively achieved. First of all, I really would like to warmly thank the co-organizing team. So Sylvie, Tim, Tina, Liz, and Stefano. But to put together this big event, as Sarah mentioned, we really relied on an expanded organizing team. So I would like also to thank the fellows at US CDC, the EpiWing team in WHO, and I'm sure I'm missing many people, but thank you to everyone who contributed. The conference has been organized in less than a month, and it was a great collaborative effort between WHO and partners to ensure that everything was ready to allow fruitful discussions. To prepare all background documents and to ensure that the conference ran smoothly. We had 2 fantastic chairs, Neville and Diroge, as well as a total of 10 amazing keynote speakers during the pre-conference and the closed scientific conference. We had 8 great topic masters, 8 very motivated and dedicated topic assistants, as well as 4 amazing coaches. So just to give you an idea of the scope of the preparatory work that was needed to organize this conference, just for the closed scientific conference, we had more than 49 organizers and speakers involved. So it was really a big machinery to make this happen. I would also like to thank all the participants for their time and their involvement in the conference. We know it's not easy to dedicate many hours of your time during busy crisis period, and especially at short notice. I think this really demonstrates that there is a great interest currently in this field and that we need to build on this momentum to advance the science and to be better equipped to tackle infodemics. So the format of the conference was quite original and successful. We had a pre-conference open to the public with 7 amazing keynotes that really set the scene. We had more than 11,000 people connected online from various regions in the world. We had people coming from academia, from the healthcare sector, from international organizations, from public health authorities, from NGOs, from the private sectors, from civil society, as well as from the media. So very diverse expertise represented. Then we had the closed scientific conference that gathered more than 110 experts around the world. We had 20 disciplines represented across 19 time zones. So it was quite a nightmare for the organizing team to schedule all the meeting, but we had a very dedicated experts who joined us for the discussion even during night hours. We had an opening day with keynote speeches, and then we had an intensive closed working session called the sprints. And experts were grouped in 4 teams, and they were discussing 4 topics over 2 weeks. We had a total of 16 sprints for a total of 32 hours. And if you combine the work of all the experts who participated, it represents about 3,000 hours of work. So it's quite amazing. And the sprints discussion were brilliantly driven by our topic masters. So around 4 topics. The first one was, how can the digital physical information environment be measured and monitored? The second one, how does the information originate and spread? Third one, how does information affect and impact individuals and population? And the last one, what intervention work to protect and mitigate? So about 86% of the participants say that they think WHO should run conferences similarly in the future. and I tend to agree. I think it was a really productive way to conduct meeting. The sprints lasted for 2 hours twice a week, and people were very engaged in the discussion, probably more if they were in a meeting all day. They had time to, between the sprint, to look at the background documents and to prepare for the discussion. And we also had electronic tools that enabled us to conduct surveys and to share experience and research work in real time. So it was a really, really interactive meeting, probably much more than traditional ones. I just would like to highlight a few outcomes of this conference. So first, we are really defining together the field of infodemiology, the science behind managing infodemics. So this starts with defining and agreeing on a common vocabulary. And here my colleague Stefano will talk more about the glossary in a few minutes. We are also building a community of practice and a community of research together. And I was a topic assistant during the conference, and it was really great to see people from the very different fields coming together to work on some topics, trying to understand one another and sharing their knowledge and experience. Many participants reported that they made connection with other participants outside of the meeting. So there was, and there is still, a great appetite in continuing this enriching collaboration in the future. And my colleague Liz from US CDC will talk more about how we will continue to collaborate on this in the future. We also have started to build a public health research agenda to direct focus and investment in this emerging scientific field. It is articulated around 5 streams. So how to measure and monitor the impact of infodemics during health emergencies, how to detect and understand the spread and impact of infodemics, how to respond and deploy information that protects and mitigates the infodemic and its harmful effects, how to evaluate infodemic intervention and strengthen the resilience of individuals and communities to infodemics, how to promote the development, adaptation, and application of tools for the management of infodemics. And here, again, my colleague Liz will talk more about the research agenda. So lastly, I would just like to mention that we have a lot of material published on the WHO website about this conference, about infodemiology, and about infodemic management. We have videos, we have the booklet of the conference, and we have some drawings, and soon the report of this conference will also be available. So I'm sure we have shared with you the link, or it will be shared very shortly. So thank you again to all, and over to you, Sarah.
Thank you very much, Margot. I think huge congratulations to the organizing team for not only leading in a new subject area, but also leading in a new way of virtually organizing global meetings. It seems like it was a huge success. I'd now like to pass to Brian Yao. Brian Yao is also a colleague at WHO here at headquarters. He works in the vaccine safety team. However, Brian has a background in product design, working for 10 years in the commercial sector, helping organizations achieve recognition and growth. Brian was also a part of the conference organizing team as one of the technical staff, and he's going to share some experience from the coach's perspective. Over to you, Brian.
Thank you, Sarah. It's been an absolute pleasure to be involved in the conference, and it's actually been handed to me on a plate because the organizing committee have dotted every I and crossed every T. It was fantastic. The title of coach actually inevitably brought my competitive instincts out. And I really wanted to get everyone engaged and enthusiastic, but it wasn't necessary because everyone was already engaged and they all recognized the infodemic as a global problem. So just I just want to relay some of the team trends because I'm speaking on behalf of the 3 other coaches. So from my team, the team members were united and supportive of each other's viewpoints throughout the sprints. And each discussion was enhanced by the different perspectives. As the sprints advanced, there was an increasing appetite to expand the field to include other disciplines as well. So this is the start, the first infodemiology conference, and I think everybody is prepared and really wants to continue with this. And so the yellow team coach, which was Neetu Abad from the US Centers for Disease and Control and Prevention, remarks that from this first sprint onwards, participants found ways to leverage their diverse backgrounds to speak a common language, often using specific examples from their work. E.g., a historian used the history of HIV messaging to explain how COVID-19 messaging can avoid making similar mistakes earlier in the pandemic. And blue team coach, Daniel Hugum-Dobler from the WHO. As the discussions progressed, blue team showed a trend towards more meaningful dialogue, building on and responding to comments made by other team members. As a result, the outcomes of the discussions became clearer and reflected greater consensus. And finally, red team coach Tom Trewenard, also from the WHO. The team shared a wealth of experience approaching this topic from their relative disciplines and shared the benefits and challenges they had encountered. Many shared, some unique. The team did a great job highlighting and engaging with the challenge of balancing scalability and local context. And again, I just wanted to not only thank the organizing team, but also all the participants from their diverse backgrounds. They all came together and recognized the importance of the subject. And it was just really great to be part of. So thank you very much. That's just my brief take on the conference.
Thank you so much, Brian. And I just want to highlight the fact that if you are new to this area of work and you want to know a little bit more about how the conference was organized, there is a conference booklet on our website that kind of lays out how it was organized and has the kind of agenda, so you get a better feel for how it actually worked. I'd now like to hand over to another colleague from WHO, Stefano Brezzo. Stefano is a consultant who is supporting our infodemic management pillar of the COVID-19 response. He's busy when he's not working on infodemiology, completing his PhD in political science and international relations at the University of British Columbia. Stefano, of course, was also part of the conference organizing team, and he was supporting the development of the glossary. Stefano, over to you.
Thank you, Sarah. I'm Stefano, and I also was part of the group that worked on the glossary. You should see the slide soon. And I would like to give you a brief overview of where we're at. What you see in the slide here are some words from the glossary, as it was towards the end of the conference. Now, this is not fancy, but in the main, it seems to me to give a fair idea of what were some of the key terms discussed. You'll see information, social networks, but also data and literacy. Next, as a reminder of the main purpose of the glossary, I would like to remind you that basically it was twofold. So the first purpose was to provide a common understanding of terms that are related to infodemiology, especially as these terms often have their roots in several disciplines. And also to provide a place during the conference that was dedicated to the discussion of terminology. If you look at the left of the circle there, it will give you an idea that we included 80 terms, 80 initial terms at the beginning, and over 50 new terms were included during the conference. Also, during the conference, additional 100 terms were indicated as to be of particular interest to the infodemiology discussion. That brings the total number of terms in the glossary at over 230. But this number by itself doesn't give you an idea of three crucial aspects of the work. The first one is that many terms were connected to other terms during the conference, sort of mapping out what is relevant to what across several disciplines. Also, terms in the glossary now have multiple meanings, reflecting multiple uses. Think of a word like diffusion. It may refer to different things, whether we are talking about physics or in social media. And what came up was that we're going to have to be clearer about using these terms in context. The number by itself also doesn't give you an idea of the interdisciplinarity of the conference, including 15 and more fields, and the breadth of the expertise and the bodies of literature that are involved in compiling this glossary. Next, I'd like to walk you through the process through which the glossary was put together. we had some initial terms to get us oriented and to get us started. But after that, as during the sprints, which were during the expert discussions, a lot of terms, during the discussions, there was put a spotlight on some terms that needed a clarification. And that happened during the discussion of specific topics. And during these discussions, topic assistants and rapporteurs were always present and were taking notes. So that when it came time to do the edits to the glossary, either some participants could input their edits directly into the glossary after approval or after a discussion, or we input the edits directly based on the expert discussion that was going on. Now, one thing that this picture doesn't actually get right is that after the time to edit, we have the glossary in its current form, but it wasn't such a linear process like this slide seems to suggest. We actually took advantage of multiple sprints, multiple discussions over different days in the 2 weeks that the conference happened to go back and forth between the third and the second step. So editing and then going back to make sure that we were actually capturing in the glossary the discussion of the experts. Next, let me give you a more concrete example of this. So we started with the word literacy. And we figured at the beginning, perhaps we can include the different meanings of this term only under one term with different meanings. It was clear very soon that this was not the case because the word ballooned and exploded into different terms like media literacy, health literacy, digital, information literacy. And that was the beginning. Then during the conference, participants and experts noticed that those categories weren't nearly enough. We needed to include also critical health and new digital literacy. And these are all new categories that needed to be included in the glossary, which they were throughout the conference. What this highlights is that the glossary is meant to be a living process. It doesn't grow the tree of knowledge and good practices by itself, of course, but it can give a boost and facilitate. Next, I'd like to leave you with this. First of all, the glossary is a starting point. As you've heard it before and you'll hear in the rest of the webinar, the aim here is much higher, and this is just a small piece of it. There's a long road ahead, and terminology is often a first step. Two definitions which are particularly crucial. One, the definition of infodemic, as their overabundance of information, some accurate and some not, that makes it harder for people to find trustworthy sources and reliable guidance when needed. The effects of an infodemic are compounded during an epidemic or a pandemic, as we are in now, which makes it especially relevant. And also infodemiology, as you've heard before, the discipline dealing with infodemic management. The next steps in the future, we expect that the glossary will continue to be a living document and it will be available for public comment, and we'll share more details on this as soon as they're defined. Lastly, I'd like to thank all of the contributors, and especially Patricia, who's also co-curator of the glossary at WHO, and all of our topic assistants and rapporteurs, including topic masters and coaches, including Margot and Brian, you've heard from before, because they work tirelessly in reporting and collating and connecting and cleaning up the wide-ranging discussion that was sometimes going on at 3 in the morning. Beyond adequate doses of coffee, it was the experts' enthusiasm and sparkling insights that kept us focused on the conversation at all times. So thank you to those who participated. Thank you to you who are interested in this. Back to you, Sarah.
Thank you very much, Stefano. What an exciting project to be involved in, drawing on all these different disciplines to try and create a kind of common platform for which the science can be built. We're now going to watch 2 videos from members of the organizing team where the speakers of the videos are going to share their experience. Tina, my colleague, is going to play those videos now. Over to you, Tina.
Okay, the first one is from Anatoly in Canada.
Hello, I'm Anatoly Grust, Associate Professor and Canada Research Chair in Privacy-Preserving Digital Technologies at Ryerson University in Toronto, Canada. Together with Neil Johnson, I had the privilege of moderating discussions around topic 1, where we ask, how can the digital and physical information environment be measured and monitored? We had many fruitful discussions around this topic, but what stood out for me in particular is the fact that Before we can even figure out how to manage infodemic, we first need to understand and agree on how do we properly manage user-generated data that come from social media and other sources. This is because the issue of handling social media data and other trace data is multifaceted. It requires a common framework to examine such data through technical, ethical, and policy angles. To help us with this, we can turn to the emerging notion of data stewardship. It used to study data practices of research labs, mostly in hard sciences, but it can also be applied to other types of data, like social media data, because it covers main data management steps, such as collection, storage, analysis, publishing, and reuse of social media data. But unlike data generated in labs by researchers, social media data is generated by users and being curated by social media platforms. So for researchers like ourselves, we have to negotiate policies and expectations from both users and the platforms, and consider not just technical, but also ethical issues of handling such data. Here are some key takeaways that emerged from our group discussions on this topic, as well as from some previous research in the area. So social media data stewardship is not a one-size-fits-all framework, in particular because privacy will vary across users, and data types. And that even if we work with publicly available social media data, we as researchers still have ethical considerations to examine when using such data. In particular because for many social media users, there's no difference in their privacy concerns, whether you ask them about private or publicly available social media data. So for further discussions on this topic, I will refer you to Association of Internet Researchers Guides on Ethics. And here are some useful references based on some recent work in this space. Thank you.
Great, thank you. And here is also, whoops, just a moment.
Thanks, Tina. Can be tricky managing all the different
yes, apologies for this lapse. So I will now switch over to two other topic masters, two facilitators of another topic discussion. I'm just setting up the video now, and we'll start sharing the screen.
So, hello everybody, my name is Sara Rubinelli. I'm a professor of health communication at the University of Lucerne in Switzerland, and I was co-chair of topic 4 about how to manage an intervention to manage infodemics. It was the first time that I did a conference in this format, and from my perspective, it worked really smoothly because we had a very enriching discussion. Everything was very well organized and structured, and I really appreciated the multidisciplinarity and the passion that everybody had in dealing and discussing this topic. So I'm very happy because in the end we came out with a very good recommendation that can really base infodemic as a science. So in my view, it was perfect, and I hope that we can continue working on this because it's a very exciting topic and a very exciting approach. And I would like to thank WHO for making all this possible.
Hi, I'm Emily Braga. I'm at the University of Minnesota in the United States, and I want to agree with everything Sarah said. It was such an invigorating experience, meeting so many people from so many different perspectives. I thought that was really the strength of the conference, that we got to talk to people from a lot of different fields all over the world who could offer the unique perspectives on how to manage this infodemic. We have some really fascinating insights, and I'm excited to see what happens next. So thanks to the World Health Organization. This was a lot of fun, and I hope we get to do it again.
Thanks very much, Tina, for sharing those videos. And we're actually going to go now to Emily Live, who's joined us as a panelist. As you heard, Emily is an associate professor at the Hubbard School of Journalism and Mass Communication at the University of Minnesota. And Emily was also part of the conference organizing team as one of the scientific facilitators. So Emily, very happy to have you. Over to you now.
Hello, everyone. I'm here to represent the topic masters, and you just heard from me, so I'm not going to repeat a lot of what I said. But I do want to say that one of the things that I thought was a real strength of the conference is the opportunity to work with so many different groups. So you've heard a little bit about how that conference was organized, and it meant that each week we had these different groups coming in to talk about questions that were meant to be focused in a particular domain. So Sarah and I were in charge of interventions, thinking about different correction strategies that could be employed to dealing with the infodemic for COVID-19 especially, but also laying a groundwork for any future health crises where we would need this kind of rigorous intervention. And so what was really exciting was that each group was focused on our conversation, but it was also a continuation of the conversations the groups had been having because they were working together throughout these different sprints. So we would get to enter into a conversation among a group of researchers and try and shift it a little bit to be talking about intervention specifically, but also really gleaning from their insights. And so even though it was the same topic, the first sprint and the last one looked really different because we would build on what we already knew. We would bring the insights from the previous groups into the last one and help us really refine some of the knowledge that we were already building. So I wanted to highlight a few of the key takeaways from our perspective. I think they will differ a little bit depending on which topic master you speak with. But the biggest ones are first just that interdisciplinarity. You heard from the glossary team. There are so many insights we can borrow from a lot of different fields, health communication, risk communication, actual public health, social network analysis. And so far, we each have our own vocabulary. So encouraging us to find ways to speak to other people in other fields, figuring out where those connections are, where we didn't necessarily see them. And then finally, testing and doing research to see which lessons apply to infodemiology and which don't. Some health recommendations might really translate easily. Some of the terms that we use for epidemics might apply to infodemics. Some won't. So that's an exciting area where we all are committed to doing more research. I would say that a great example of that, and you already heard, is the idea of literacy, which came up in every single sprint that we did. That literacy might be a way to help us build resilience so that people themselves are empowered to recognize what is good information and what is bad information. There's a lot of research on a bunch of different ways of defining literacy, all of which has some promise, but all of which also has a bunch of limitations where they haven't necessarily applied them to this topic. So that's a space where getting all of these people from different fields in the same space really helped build that groundwork that will allow us to test literacy against infodemics. Likewise, thinking about the personas that one of the participants mentioned, thinking about who the vulnerable audiences are and whether we're talking about vulnerability in terms of disease versus in terms of information consumption versus in terms of information spread is going to be really important. The other kind of ways to think about it are in terms of what are the actual interventions that we need. And so we decided that as a team, what we need is a living systematic review, a place where all of us can look and see what is the misinformation that is spreading, what are the characteristics that are going to make misinformation spread particularly problematic, and then what are the interventions that we know are likely to be successful against those types of misinformation. Again, there's so much great research being done, even more than I was aware of. And so finding a place where all of us can speak to each other more quickly, more readily, where we're building on each other's work rather than working in silos is, I think, the promise that this conference really represents to all of us. And so I think it was a fantastic experience and one that I hope can continue with the foundation that we've laid in the past 2 weeks to inform all of our decisions and reinforce the connections that we made over the past few weeks.
Thank you very much, Emily. Very happy to hear your experiences and also the desire to continue this work and collaboration that's ongoing around the world. I'm going to now pass to Pier Luigi Sacco. Pier is a professor of cultural economics at the IULM University of Milan. He is also a senior advisor and faculty associate at the Berkman Klein Center for Internet and Society at Harvard University. Pierre was a participant at the conference and is going to comment on his experience. Pierre, welcome to the webinar.
Thank you very much. It's been really a wonderful experience to participate in this webinar. And I would say that most of us, as Emily, by the way, was remarking just before, most of us have experiences of disciplinary conferences where, of course, you have a very exciting meetings with very competent colleagues, but at the same time, in some sense, you're all on the same boat and you know exactly where this boat is going, more or less. But here, you have a completely different kind of experience. This was about connecting a very diverse community from the point of view of the disciplinary backgrounds of people who were very different, the competencies that despite the difference in background, there was yet a further level of difference in the specific competence and interests, and of course the geographical variety of the group. So this was really refreshing and gave, I think, to all participants an incredible opportunity to understand in this moment what is the pulse of the different sensitivities, the different views on such a complex problem like infodemics. What if I should summarize briefly in one sentence, what was the purpose in the end of this exercise was probably establishing a forum for collective intelligence. It's really something about not simply just bringing together many reasoning people, but creating a new layer of reasoning that was really, in some sense, getting out the best of the single disciplinary perspectives. And this, of course, was difficult, and clearly we are just at the beginning of the journey. So first of all, it was about finding and co-building a transdisciplinary space to frame infodemics, because clearly, I mean, there are so many angles from which you can take it. So how do we establish a common space for this? So this was clearly the first step. And I think that throughout, I mean, I of course had a different experience from Emily because I stayed in the same group for all the 4 stages. But what I saw, for example, was that this was this gradual building of this common space, and more and more confidently, we were able to interact with each other, knowing each other in ways that would really enable a different level of reflection. A second aspect is, of course, translating and in some sense going beyond disciplinary languages and mentalities, because of course in a situation like this, everybody comes with a vocabulary. Everybody comes with a frame of mind that is shaped by their own discipline. And it was very important and meaningful and difficult to establish more and more a common language. And in this sense, of course, what the glossary did was amazing. And I think, again, this is just the beginning. We can really do a lot starting from this glossary. And then, of course, the problem has been, and still is, the difficulty in achieving a synthesis. Could I say that now I have a clear idea how to tackle infodemics after this webinar? Of course not. I understood how difficult it is to achieve a synthesis. But at the same time, I also saw very concrete possible steps to arrive there, and especially how useful plugging into different disciplinary frameworks can be from this point of view. So I think that the common feeling that emerged from this interaction is, and it was just repeated also, by the way, at the end of the session, the final session by all participants, was the clear understanding of the value added of working together in this way. So I think that what the WHO did with this is already a milestone in its own right. The fact of creating an environment for such a level of global collaboration on an issue is an endeavor in itself. But more concretely, what did we get in terms of takeaways? Infodemic, I think that one thing that is clear, and I think it's also important to stress this further, is that there are several different viewpoints that are crucial to understand infodemic. There is a computational viewpoint. Of course, big data from this point of view are of crucial importance, and our ability to tap into this incredible flow of information is probably going to make the difference, because this means in particular being able to react in real time. It's almost impossible to have an evidence-based intervention through sources other than, for example, social media and online content that really